Hello and welcome you all. Today we are discussing about an important aspect of our health, a problem which many of us can face in our lifetime, strokes. But why is it so important? Because it concerns the brain. So, of all the organs in our body, if there is a boss, that's the brain that controls all other organs and functions of the body. Even if you are listening to this video or watching it, it's not only your ears and your eyes which are functioning. All this information is being processed in the brain to have a meaningful outcome. Every movement that you do is controlled by the brain. Every thought is there in the brain that is originating. So, brain is the most important organ and it has various parts. If you consider it as an engine, each part has specific function, like for the speech, for hearing, for vision, for movement, for sensation. Everything has different parts that is assigned in the brain to function. So, this engine needs energy to function. How much energy? It's huge. Brain forms only 2% by weight of our body, but it receives 20% of the blood which the heart is ejecting. So imagine how much metabolically active brain cells are. So its energy is receiving through the blood, and suppose the blood supply gets obstructed by a problem in the channel that supplies the blood or bursting of the vessels, what will happen? That segment which this blood vessel was supplying, that will not get blood, and the neurons in those areas, neurons are the brain cells, so these neurons will stop functioning, and once they stop functioning, your function of that part of the brain goes. Unfortunately, these brain cells, the regenerative power is very less, almost nil. So if there is a problem, if there is some part of the brain is not functioning, then the chances of its regeneration and regaining power is less. That is why it is more important to prevent this from happening. So, what is stroke? Stroke is nothing but there is an obstruction of blood flow to some part of the brain. Either because if you consider the blood vessels as the channels or a plumbing line, if there is an obstruction in that pipe or the pipe bursts, then those parts of the brain will not get blood, and this is called stroke. And according to these two mechanisms, there are basically two types of stroke. One is the ischemic stroke. Ischemic stroke where the pipe gets blocked. And the second is the hemorrhagic stroke where the pipe bursts and the blood spills out to the surrounding structures. There are even other smaller kinds of stroke, such as TIA or transient ischemic attack. It's nothing but it's almost like a ischemic stroke but on a minor degree where the problem of the brain that occurs because of the loss of blood supply gets corrected very quickly and the brain functions return to normal. So, if these are the types of stroke, then what are the risk factors? Why does it happen? The common risk factors are high blood pressure, cholesterol, high cholesterol in the blood, obesity, diabetes, a sedentary lifestyle, increased age. More number the age, the higher chances of your getting stroke. In fact, if you see, the more number of patients above age of 70 will get stroke. But that doesn't discount that younger patients won't get a stroke. We are now getting many young patients, they present with a stroke. So every one of us are at risk and we have to take care. What are the features? How can you understand that either you or any one of your family members or your friends or someone who is around is having a stroke? The very easy way to understand is by FAST rule. What is FAST? F is for face. So if you ask the person to smile, or if you see the face is drooping on one side, then the patient may be having a stroke. It is asymmetrical. Both the sides of the face will not be equal. Second, A is for arm movement. So we all know that the brain has two parts, two sides, the right hemisphere and the left hemisphere. The right hemisphere controls the left side body movements. The left hemisphere controls the right side body movements. If the one side of the brain is affected, the other side motor activity, like if you ask the person to raise the arm, that side arm will be weaker. If he tries to walk, he will have problems with the balance and the side of the legs will be weaker. It can be weak or it can be totally paralyzed depending on the degree of the damage, what we say as paresis or paralysis. And the person will not be able to get up from the bed if he is so weak. S is for speech. So if you ask the person or talk to that person, you will see that the person is having a slurred speech, not being able to articulate his words. These are the early signs that you see. And if it is a major stroke, then it will lead to even unconsciousness. And what is T? The first and the last thing that you have to remember is that time is of essence. So if you see these features, immediately rush to the hospital so that this person has some time to get treated. The earlier you treat, the better are the chances of recovery. So, what are the kinds of treatment that we have? If we reach the hospital which is equipped to treat these persons, we can see that the doctors may prescribe medicines which will dissolve the clot and have a smooth movement of blood again through those plumbing lines or the vessels. Or if it is a hemorrhagic stroke and it is a massive one, which is causing pressure to the surrounding tissues like in the brain cells, then the doctors may even suggest a surgery to evacuate that clot. So the treatment varies. But again, the outcome of the treatment we don't know initially. And the patient, if not reaching the hospital early, may have a prolonged debilitating course of events where he will be bedridden for a prolonged period of time. So it is primarily the prevention that is most important. So, how are you going to prevent stroke? Is it at all preventable? See, we have seen the risk factors, and many of these risk factors are modifiable. If you change your lifestyle, stop smoking, stop alcohol intake. If you exercise regularly, keep your blood pressure and the blood sugars in check by regular medications. All these things will help to prevent stroke to a greater extent. At least 1 in 4 people, they will experience stroke once in their lifetime. So, if we are cautious enough early in our life, then we can prevent stroke. If we have reached an age, don't worry. This is the time that you have to take action. The best time is now, and prepare yourself to have a better life tomorrow. Thank you.